And Brenda? Good evening. My name is Dr. Travis Hoffman. I serve as your University of Minnesota and North Dakota State University Extension Sheep Specialist. We are excited that you are willing to join us this evening, or if you're watching this after the fact, thanks for joining us as well. We have a talented University of Minnesota Extension sheep and goat team that has been hosting webinars on a monthly basis. And so this is our June 2022 edition. And in fact, in comparison to what our colleagues at South Dakota State University had completed on a needs assessment, we identified, and that group identified, that parasite management is one of the imperative and important things that we want to accomplish, particularly now as we think about it as early summer, and Dr. Cindy Wolf will explain why. Additionally, this evening, we will talk about some of the FDA guidelines that will happen in relation to over-the-counter antibiotics and how those relate to your production focus for our sheep and goat producers. And so thank you for filling out our initial survey, and we will have a post survey, so please stay on at the end, and feel free to ask questions as we get through those. Feel free to ask those questions as we get through the chat, as it may come to you, and so that we can know what those questions are, and yet we will still continue to have some dialogue at the end of that portion. And so I'd like to first off introduce my colleague and talented expert here that had served previously at the University of Minnesota in extension, and had a sheep and goat extension kind of focus in a veterinarian approach. And so Dr. Cindy Wolf has been kind enough to join us and to be able to provide some information. And so I'm going to pass the baton to Dr. Cindy Wolf, and feel free to share your screen and provide some knowledge for us, Dr. Wolf. Thanks so much.
Thank you, Travis. I just got to figure out, sorry, how to, thank you. I always struggle with that. Okay, well, for those of you who don't know me, because I have been gone from the university for about 4 years now, I'm a sheep, goat, and beef producer in Southeast Minnesota. I did teach veterinary students for about almost 35 years at the college there in St. Paul. I had a super fun job because my most recent boss at the university let me take students to farms, and we did real work every day that I had students, and had a tremendous group of clients who really helped those students become better veterinarians. But let's move on to the world we're in right now, and that's the two topics that Travis has assigned me, if you will. And we'll talk about sort of the least sexy one briefly, and we can always come back at the end with questions. But let's just talk about what's happened here, and I'll just try to hide this. Okay, so the Food and Drug Administration, they're in charge of licensing and labeling many of the drugs that are available for our animals, whether it's pets or livestock. And they've been working for a number of years on something we call antimicrobial resistance, meaning that there are a lot of people and animals now that have infections that are resistant to our common antibiotics. And so if you all think for a minute, we all have had some relative or friend who either was already in the hospital or had to go in for medical care because they had a drug-resistant infection, and sometimes they can be life-threatening. And so because of this, the Food and Drug Administration's released a new document. They call them guidance documents, which I always find humorous because really it's a regulation, but maybe they have a little less red tape releasing that kind of document if they call it a guidance. And basically it's telling us that we are not going to have any over-the-counter antibiotics after June of 2023. And the more I read and study what we know about this new world that we'll be entering, it sounds like it could even be starting sooner. And in my world, it has already started, because if you go shopping for procaine penicillin, you've had a real tough time finding it. And that's probably true if you also bought your oxytetracycline or long-acting tetracycline from Fleet Farm. You've probably had a tough time finding it. So they recognize, they being the FDA and the medical community, recognize that we have a problem. And by starting to make these antibiotics by prescription only for livestock and for pets, then the regulators think that we will have improved and more responsible use of antibiotics. I hope that's true, to be quite honest, but I have a feeling that we're not going to totally solve the problem by going this route. Which antibiotics are going to be affected? I've already really listed them. That's oxytetracycline and penicillin, so injectable over-the-counter antibiotics. Right now, they're not saying that one of our drugs for coccidia is going to be infected, sulfodimethoxine, some people call it Albon. They're not saying that the oral products will be affected. And then I put like Zactran, Draxin, these stronger ones in a different color, because that one's already by prescription only. Okay, so what's it going to mean for you? It's going to mean that if you don't already work with a veterinarian at least once a year, where that veterinarian feels familiar with your farming operation, whether it's a hobby farm or a larger scale farm, you're going to need to develop a relationship with a veterinarian, so that one, they're familiar with you and your animals and your usual problems. I'd like to believe that many of us are problem free, but as soggy as we have been this year, we are really grateful for the grass, but it's going to pose any number of problems, everything from more parasites and foot scald and fly strike and respiratory disease and so forth. So anyway, we all have some problems, sometimes more problems one year than another. So you have to have that relationship. By statute in Minnesota and every state in the country, this relationship with a veterinarian requires the veterinarian comes out to your farm once a year. And a bit of advice is I'd have that visit fairly early in 2023. And I would be organized. I know it very commonly in my profession, I hear that vets have gotten too expensive. And I will just be able to agree that, yes, the cost of having a veterinarian come to your farm has increased in my lifetime, but so has everything else for that matter. So I'm not going to discuss whether vets are too expensive, because I can't affect change in that area. But I can tell you as a producer that the more organized you are when you have this once a year visit, then the less it will cost you because of the increased efficiency, and your veterinarian will really appreciate it. So what does that mean? What do you need to be organized about? You need to know what drugs that you might want to be getting from, whether it's your veterinarian or you want them to write a script and you buy them from a retail pharmacy. Minnesota's blessed, if you will, in that we have a retail pharmacy that's highly efficient and very cost competitive, called Leadstone. I'm not doing a commercial for them. I just am sharing with you that if your veterinarian happens to be a small animal vet, let's say, because there are small animal vets who really like sheep and goats, but maybe they don't stock that many of the injectable antibiotics that you like to use, well, they could very easily do the script through Leadstone, and then you can get the drug there. Requirements of a veterinary client-patient relationship, and I think that's why whoever designed that phrase calls it a VCPR. Basically, the veterinarian is responsible for diagnosing and giving you advice on the problems in your animals, the health problems. And that's why there's a requirement that they're there once a year. They're also available to talk with you, whether it's by the, whatever their method of doing it is. Okay, I'm not going to say what's perfect for every veterinarian. I will tell you that a lot of my clients do a tremendous amount of texting. And it's good and bad. It's just that if that's the way you communicate with your veterinarian, be sure that if you don't get a response in a day, that you just kindly say, hey, did you happen to see my text? Because sometimes when we're busy, I don't know how those texts vanish, but I think as memory cells deteriorate, you forget it came in and that you needed to respond to it. So it's not saying that the veterinarian's available at 2 o'clock in the morning for a dystocia, but it's saying that they're available to help you with your continuing care. And so for me, I really like for my client communications to finish coming into me by 9 p.m. at night, because after that, I have kind of the jelly brain, not from alcohol or anything like that, just from age and the amount of work. And so I have a much easier time giving educated information back on cases that I've been working on, if that information comes in before my brain gets squishy. And then the veterinarian has to keep records. So not only do they have to keep records that you're a client and they worked on sheep such and such for this and that problem, but we have to keep records that we dispensed long-acting tetracycline. Let's say we dispensed 100 ml bottle, and we obviously, as you know, have to keep records that we made a label on that bottle that said to give that particular 8 cc's every other day for 3 treatments, and they had a meat withdrawal time of 28 days after the last treatment. And so any of those records, if that treated ewe was slaughtered and there was a residue found in her, then the agency that comes and does follow-up could say, let me see those records. So that's kind of why we have to charge something, because it takes time to keep those records. So your producer role is figure out who your veterinarian is going to be. Like I say, there are small animal veterinarians who can provide you with some service. Think about what your usual problems are. Do you usually do a preventative treatment for coccidia in your lambs around weaning time? Do you sometimes find that you have a hot pneumonia go through when those lambs are 5 months old and the weather keeps flip-flopping around? Or do you have some baby lamb pneumonia, and how do you treat that? What injectable antibiotics do you need to have? I like to have a drug called Flunixin, which is good for making an animal with a fever and an infection feel better and get them back on feed sooner. So think about what's usual on your farm, have all that communicated with your veterinarian, ideally by email ahead of coming out to your farm, so you guys are both prepared to talk about that and your visit will be more efficient. And then talk about, well, how am I going to get other antibiotics throughout the year if I need them, and come up with a system that's going to work between that clinic and your farm. Okay, so yeah, we'll continue to have antibiotics. I suspect they might cost more in the future. I don't think that's a shock. And I do believe it is for the greater good that we have to move to this route to try to preserve the effectiveness of antibiotics as they work in human and animal infections. As far as a crystal ball, some days mine seems to be working and other days not. Do I think all antibiotics will eventually become by prescription only, meaning oral antibiotics? I kind of do think that we'll be seeing that in the future, but I haven't heard anything to that effect. Okay, well, let's move on to parasites. I'm just going to see if there's, okay, I don't see any relevant questions. So this is going to be, and has already started out to be, a bumper crop year for parasites in Southeast Minnesota, because we're just having tremendous rains and tremendous humidity. So thinking a little bit about parasite management, it's no longer, as many of you have experienced, the same as our dad used to do it or our granddad used to do it. We no longer can reach for some chemical, push it down the mouth of a lamb and then all will be well until we market that lamb. Basically, many of us who are really serious about this have a control plan that we try to evaluate how well it's working. And as we develop that plan, we have to think about the parasite life cycle. We have to think about who's going to run our fecal egg counts, if we're going to do those to help guide how well our control program's working. And if we're going to do any genetic selection, we need those fecal egg counts. We're going to do only targeted deworming. We're going to treat animals that need it and not treat the ones that don't need it. Well, I'll talk a little bit more about genetics, and I'm going to talk a bit about managing pastures to reduce parasite challenge, because all of the above are great concepts. They're great to practice, but if we leave our animals on the same pasture day after day throughout the whole summer, we're just going to get such a huge parasite burden that nothing else we've done is going to be helpful. The parasites will win. Okay. Now I seem to be having troubles going forward. Travis or Brenda, I saw somewhere that it said you highlighted my video or something. I don't know if that makes a difference or if this is just my problem.
Try now and see if it'll go forward.
Yeah, it doesn't want to. Doesn't want to go back. Wheel?
How about if you unshare and then reshare?
Okay. Sorry, I'm a little slow here. Okay. Okay. So this is, a lot of you have seen this who know me, because I really like this little video we made one day. The students and I were necropsying a lamb, and this is the inside of the fourth stomach of a lamb called the abomasum. It's the one that looks like a wine flask. And when I play this video, see all that jiggling in there? Those are probably millions, at least thousands of barber pole worms. They're also called Homunculus contortus, and they are without a doubt the major issue that we have here in Minnesota and Wisconsin and Iowa. And so then the other thing to look at here is that the inside of the abomasum usually looks like it's the same color as whatever the animal's been eating. So if it's grazing grass, it should be a nice green color. And this looks like this animal had a big drink of coffee, right? It looks like the color of coffee grounds. And the reason for that is the Homunculus contortus are piercing the wall of the abomasum to get a drink of blood. And a bunch of this old blood has got inside the abomasum, and old blood looks like it's brown. So this is a horrible thing to see. There would be no saving that lamb, as many Homunculus contortus or barber pole worms are there. But if you had a fresh dead lamb and you know what the abomasum looks like, then if you open it up, like it just died 15 minutes ago, and you open it up, whether this is June, July, or August, and you saw all this movement, or you poured the contents into a plastic bag and a bunch of these red striped worms stuck to the side and also were moving, you know that's what killed that lamb. Okay, so let's share about some people who are doing some great work. Since I usually am outside doing farm work, now I try to watch other folks' webinars as well. And so we have a colleague of Travis Hoffman named Dr. Andrew Weaver, who is working at NC State. And if you missed this webinar a couple of weeks ago, it's on the ASI website. And so I picked a few of his slides out and would just say that that 90 minutes is well worth watching it to get parasitology is hard, and it's good to see it repeatedly. So why did I pick this slide out? Well, one, I wanted to give Andrew credit, but I wanted to show you these worm eggs. Okay, some of you do your own fecals, and there's lots of charts out there, but these are your classic, what we call strongyle. So let's imagine that Homunculus contortus has a bunch of siblings in its family, but the siblings all have they share one parent but not another, so they're family members. But this is a classic egg of a strongyle, and Homunculus contortus in the strongyle family does also look, its egg looks just like this. So I thought that was kind of a good thing to share. We've got to understand how Homunculus contortus or barber pole worm infects the sheep. And so basically, these are the infective larvae. Veterinarians and parasitologists, we call these L4. L4 can only climb up the grass inside a dewdrop. So that's a little water bubble or a dewdrop that's there every morning in much of Minnesota. And it can only climb up about 4 inches. After that, it cannot climb any higher. So when people tell you, don't let your sheep or your goats graze any closer to the ground than 4 inches, and then you should move them, that's why, because these little infective larvae are best able to climb between 0 and 4 inches on a blade of grass. The sheep eat it, it goes up and sets up house in the abomasum, which is supposedly this green thing right here. And here's an adult Homunculus contortus. So we have this red stripe, which is blood, and also the reproductive tract. And then this is a very smart worm. This female Homunculus contortus can spit out not literally, she can produce millions, I said that wrong, thousands of eggs a day. And so they're really good at trying to keep themselves going out on pasture. And then the time from this sheep eating it to putting these eggs out to them becoming what's called a first stage larvae or L1 is about 3 weeks. Then once it's out on the grass, from going from a first stage or L1 to an infectious L3, L4 is going to be approximately 3 to 14 days. Why do we say it's so variable? Because we need at least 50-degree temperature outside, and we need enough humidity to have that dew drop. What we do to alfalfa fields when we make hay is the worst enemy to a Homunculus larvae. Anything that dries them out kills them. So right now, Minnesota pastures, they're perfect. Okay, so let's just move on here and look at some data, getting to be a little older data now, but there was a famous, now retired parasitologist at Georgia who figured out that we have a terrible dewormer resistance problem in our sheep flocks. And when he first figured it out back in the early 2000s, it was just in Southeast US. But as producers, we're good at buying and selling sheep all over the country. So we moved this dewormer or anthelmintic resistance around inside the sheep to now there are sheep all over the country that have resistance. So what this graph is showing you is this is the percent resistance against different classes of dewormers. So a example that you're most familiar with for a benzimidazole is valbazen or Panicure. So we had almost 95% resistance in those 3 states he studied. This is ivermectin. We had almost the same level of resistance. This is Prohibit or Levosol. We had a lot lower resistance to that drug. And this is Cydectin. Again, we had some lower resistance. Why was it higher in these 2 states? Perhaps they used more of it historically. So we know that in order to combat that resistance, we have to combine those dewormer families when we drench sheep and when we drench some goats. I'm just gonna move on here a minute. Okay, so here's why do I say that? Data always tells you. Okay, imagine that this was valbazen, imagine this one was Cydectin, and imagine this was Levosol or Prohibit. That's usually what most of us call it. And so you can see this is the percent resistance to those drugs, and each one of these lines represents a farm. And then if you combined 2 of these products together, we had, I misspoke. This is the percent efficacy. This is how well the drug worked. And so here's a farm that had a real disaster. That particular drug was only working 20% of the time. But when we combine 2 products or combined 3 products, we actually increase the effectiveness greatly on this farm, same on this farm, and all those farms. And so that's why we talk about making our own combination drench on the farm, or using our own combination drench. Okay, now because these drugs aren't compatible chemically, they are supposed to be given in separate drench syringes and not mixed up and given to the animal as one full mix. And probably in reality, none of us are really good pharmacists and know how to mix those 3 dewormers so they stay equally suspended, and so the animal actually gets the right dose. What else have we done bad as producers? We are bad at guessing the weight of our sheep and our goats. And that's got data to prove that as well. So we need to get better at that. And about the only way I know to get better at that is to own a scale and dose them for their body weight rather than guess it and be underdosing them. We are bad at calibrating our little drench syringes or drench guns. And by that, I mean just draw up your dose. Let's say it was 12 mils, and squirt it into a 20 mil syringe, and make sure that your 12 mils out of your drench gun was really measuring 12 mils in your 20 mil syringe. That's how you would calibrate it. And since most of us don't do that, we don't know if we're really giving the dose that we intended to give. I hope I'm making some sense. These are just El Cheapo NASCO drench guns. So if I had 30 sheep, I would own about 6 of these. Why? Because I like to use all 3 products at the same time. I use valbazen, cydectin, and prohibit at the same time. But because I'm not a good pharmacist, I would have to draw up each dose individually and squirt them in the sheep's mouth. If I had 1,000 sheep, that gets to be where we might have a divorce over that method. So we won't even talk about what we do. It doesn't work 100%. I'll just tell you that. So these are just pictures. This is Prohibit, which any of you who are buying it by the package know that it is now on back order for a long time. Here's the oral cydectin drench. Here's the oral Ivomec drench. These 2 are in the same family. So if you use, just pick one and use it. And then this is the thick white drenches, also called benzimidazole. So here's Safeguard or Panicure, and here's the valbazen. So this is family 1, family 2, and family 3. Okay, and I pick one from each family. Now, this is one of the best websites that if you like to understand parasites and you have not already spent hours reading on this website, I encourage you to write that down. Now be careful to write it down correctly, because if you write it down incorrectly, it used to take you to some porn site. So we need to know it's wormex.info. And this is about a year ago, they updated the dosage sheet for the dewormers. So you'll see if it makes it really easy. You know, you got this 90-pound sheep, and you can pretty quickly figure out how much to give. And then here's your meat withdrawal times and some mixing instructions, how long mixed up Prohibit lasts, for example. And so pretty important details. And so I just take this sheet and I laminate them back to front, and I try to keep them wherever animals are going to be worked. Okay, now if we know our major problem on a farm is Haemonchus contortus, then we ought to go through the online training and get ourselves a FAMACHA card, which is pictured here. And we're looking at the color of the membrane inside the lower eyelid, ideally out in the daylight. And we're trying to see, does it match this color or this color or this color, or the one that's not on the screen? These animals are going to die. Okay, and if the system for FAMACHA scores is the reverse of body condition. So if a body condition score sheep is a 1, is emaciated, skinny as can be, and gonna die, this is a 5 on a FAMACHA score. So a 5 body condition score sheep is super fat, and a 5 FAMACHA score is so anemic its mucous membrane color is white. So you're really looking for FAMACHA scores of 1s and 2s, and you're going to need to treat the 3s and the 4s. If you've got 5s, you're too late in your control program, and you need to go immediately and write that down wherever you write that stuff down, whether it's your phone or a calendar in the house or the barn, and say, I'm 2 to 3 weeks behind. of when I should have started my control program. The other things we look at is the animal thin? If I had a moderately pale animal, so FAMACHA of 3 right here, and it was a body condition score 2, I would probably deworm it. If I had a 3 and its body condition score was a 5, I wouldn't deworm it. Now, the other thing you ask yourself, whoops, is do we have any diarrhea going on? And so those are nice normal pellets. And this is just reminding us that we should have a scale. Okay, let's talk about a pretty hard concept, but it kind of helps us understand what we did wrong over the years. We used to deworm sheep and move them to a pasture where there hadn't been any sheep for a while. And basically, this is a concept called refugia. And so if we treat the entire herd or the entire flock, then we find that the only worms that survive are the drug-resistant parasites right here. Whereas if we treat only part of the flock, only the group that needs it, then we will end up with a population of sheep that have some susceptible worms, that's what the blue isn't showing, and some resistant worms, that's what the red and white stripe like danger is showing. And the reason we need to keep some of these blues around is we need more blues to breed with blues to make more blues. So here's Dr. Weaver's explanation here is we have killed off the susceptibles and all we had left were the resistant worms. And guess what survives? The worms and the sheep die. So we need to go back to treating only the sheep that need it so that we keep sheep around in the flock that haven't been treated and we know they have some low level of susceptible worms to the drugs that we're going to have to rely on some of the animals. Now, I don't want to forget this point, and I don't know if it's on the slide, but let's say you have 100 sheep. 70 of those sheep will not be having much in the way of parasite problems and will not be dumping out many eggs. 30 of those sheep will be dumping out lots of eggs, and maybe some of those sheep will be struggling with parasites. Now, we don't have an easy blood test or any easy tests to determine who those 30 are, because those 30 ought to either go live in somebody's confinement operation or be sure and be bred to a very worm-resistant ram, or get a new zip code, as my colleague would say, meaning that you culled them. Because you want to select for in your flock sheep that do well in your system. And if parasites are part of your issue, those 30 are creating problems for the lambs that are nursing those 100 ewes. Okay, let's talk about a tool that gets a bad rap. I can only tell you that it hasn't been a problem for me, but I know plenty of veterinarians and some producers who have had struggles with this tool. Okay, it's called copper oxide wire particles. They look much like pencil leads, and they are sold commercially, or you can buy the cow-sized one and break that cow-sized bolus open. That's how big the cow-sized bolus is. I buy the 25-gram cow-sized bolus, and then I can make 25 1-gram boluses for ewes, or 50 half-gram boluses for lambs. So what happened was this copper oxide wire particle, or COWP, was being used in some research, and this was sort of an incidental finding. But what they found was when they gave sheep a dewormer at the same time that they gave COWP, the dewormer worked way better than if you just gave the dewormer alone. So that was pretty cool finding on their part. And here's some dosages that you don't want to use your goat dosages in your sheep, because sheep, as you know, are more sensitive to copper. Some breeds of sheep are really sensitive. So for example, I'm not sure I would use these in Texels. I have used them in crossbreds that had some Texel in it and not had an issue. But I buy these empty gelatin capsules, and like I say, I just weigh what a 1/2 gram and what a 1 gram is. And I tape it to an index card, and then I just fill the rest of them to look much the same. I don't weigh 100 capsules already filled. And then the crazy thing about this is the way we think these little copper pieces work is they affect the ability for the homuncus to be swimming on the surface of the of the abomasal lining. And so those homuncus kind of get flushed away or ground up. I'm not exactly sure which, but it's not compatible with life for that homuncus inside the abomasum. So I think that's really cool. But it will raise the level of copper in your sheep. So it isn't something we give every day or even every month. The rule of thumb used to be that if you had a long grazing period and you had a long parasite period, that you would give it twice in a grazing season. I typically have found that I need to only give it once. And then once the lambs are weaned, it seems like they have a much easier time and probably a lower challenge on parasites and don't need it anymore. Okay, there's just a little $28 gram scale. So it's simple to weigh. There's just showing you, like, for example, in a size 1 capsule, this is how big 1/2 gram is. I think my little gel caps are size 1. But anyway, they're not, you don't have to give very much. The worst thing is we don't have perfect little balling guns to deliver it, and you can't stick a pill down the throat of a lamb with your fingers if you really like your fingers. Okay, so let's move along here. So this is just showing you the percent of improved effectiveness of the drug when they gave the copper oxide wire particles with the valbazen. Okay, there's just copper oxide alone, just 2 different products. And this is valbazen alone. And this is just pretty amazing, isn't it? Okay, let's talk a little bit about genetics. And so if you're wondering what this slide is, this is what we call a McMaster slide. Somebody raised their hand. I don't know if, how do you give them? Okay, the way you give them, I did not show the balling gun. You can buy little dog and cat plastic balling guns. The first thing I do when I get those, though, is I take some duct tape and I tighten up the opening at the end because they seem to be pretty weak plastic and they start flaring too wide and the little pills fall out. I think that Santa Cruz might sell a little better balling gun. You can also just take a 3 cc syringe and cut the end off and use that. So they go just like that you're taking a pill, like you have to swallow a pill, but we use something called a balling gun to get it in the back of the mouth so that the animal actually swallows it. There is a research paper that I did not retain the details on about whether you could just feed them. I know some, sorry, I'm a goat producer, so I can say this. Some crazy goat producers have talked about sticking them in marshmallows, not the pill, but just the wire particles, and getting them to eat it that way. They will eat them in grain, but we'll come back to some more questions. This is what's called a McMaster slide. And so when we talk about doing a fecal egg count, this is the special slide that you would have to order or make sure the lab that you're sending that poop sample to will run a quantitative count of worm eggs, not qualitative. So I think I put a slide in here of some of the labs that do quantitative fecal egg counts for very reasonable cost. I know I came across the other day a lab in Michigan run by a vet tech. It's her lab. And she was offering that service for $5 a sample, which I can just tell you, it takes more than $5 of anybody's time. So she obviously is a sheep and goat producer. So that's just a special slide that you need. Okay. Oh my goodness, I'm stuck again, Brenda. I wonder what I'm doing that is causing that problem. Maybe I'm just not moving fast enough. Okay, bear with me, everybody. This is when you start to feel old, when you start to have all these technology issues. At least I can remember where I left off, I think. Okay, so we left off there. All right. So when we talk about genetics, there are animals that are resilient to parasites, and there are animals that are resistant to parasites. Resilience means they can tolerate infection and still perform. That's a great thing, but it does mean that they could still shed a lot of eggs on pasture. Whereas resistant animals are able to basically limit the infection. So it seems like some genetic control of slowing down or maybe almost stopping the worm growth inside them, and expelling the worms. They're measured by doing fecal egg counts, so it's going to be a little more labor intensive than putting animals in a chute and doing a FOMACHA score. And so it's a better trait for genetics. Travis, I guess you're just going to need to chime in there if I need to look at when the hands are going up. Otherwise, I'm afraid this is going to lock up. So the good thing about resistance to parasites, it's a moderately heritable trait, 20 to 30%. That's a great thing. I mentioned this is the site right here where you could go look for labs that could run your fecal egg counts. If you didn't want to do it yourself, you need a microscope, you need time, you need a McMaster slide. You can buy the solution or you can make your solution. You don't need any expensive pipettes. You could use some syringes, but you might be like me and you'd rather pay somebody because then it will get done. And I'll give you a suggestion. If you're going to send samples out, collect them on Saturday or Sunday or Monday and get them shipped by Monday afternoon or Tuesday, because that lab needs to get them within 2 days and they need to be kept cold. Okay. A little bit about genetics is that we have a lot of variation across breeds and we have variations within breeds. So if you love your sheep or you love your goats, especially sheep, don't, just because they aren't on this list that you're about to see, don't stop raising them, because if you were to measure fecal egg counts in your sheep, you're going to find that there are some that have some innate resistance and some that don't. So here's just a list. Our Caribbean-based sheep breeds have some more innate resistance, and then what sheep didn't, well, believe it or not, black-faced sheep didn't have good resistance. Here's what I mentioned earlier, and this happens to say goats, courtesy of Susan Shanian, but this could be sheep as well. Is we have a small percentage, about 30% of the animals that are shedding the majority of the eggs. Okay, so you have selection tools that you can use on your own farm, and you have selection tools that we can send out and get even more detailed information back. And this is particularly important if you're a small flock and you don't want to be an NSIP or they're a crossbred flock, but you're buying purebred rams, is you can now buy rams that have estimated breeding value for parasite resistance. So just look at some of the data here on Katahdins. I'm not pushing any one breed, but this is their EBV for fecal egg count right here. Okay, and so they're going to range anywhere from a positive number to a minus 100. Any minus number, especially the higher the minus number, is desirable. Okay, and so look at what they have done with their fecal egg count EBV over time. So they started measuring flocks in NSIP in 2010, and they have been able to take that trend line from about a plus 18 down to a minus 12 over a 10-year period. That is phenomenal. And pretty much any good sized population of sheep breeds could do that with selection. Okay, now back to that wormx.info website. There's a fact sheet on there titled On-Farm Selection for Resistance to Parasites. And so we have a geneticist, also a Katahdin breeder, who wrote this for us. And he's got some charts here in that fact sheet that talk about some of the things that we should select for and select against on farm. So for example, when you deworm your sheep, you ought to be recording who you deworm and who you don't. When you have an animal show up with bottle jaw, you ought to record that. When you have doing body condition scoring, you should record that. When you do FOMACHA scoring, again, we should record that. And when we get our fecal egg counts, we should be recording that. So things you can select against. Let's say you have, again, 30 ewes and only one of them pops up with bottle jaw when you were overgrazing some pasture. That ewe should go somewhere else next year. Let's say you have 30 ewes and there's 3 of them that have poor body condition score. I can't tell you to cull those ewes because they might be milking and raising the heaviest sets of twins or triplets in the whole group. But I can tell you if we record it and correlate it to what their production is, it might give you a clue that they're fighting parasites or that they're actually just overachievers, if you will. Ewes that you have to deworm over and over again. 1, you have a resistance problem to your dewormers, and 2, they're not good genetics to keep. Okay, let's just keep moving on because I don't want to get too short on time for questions. One place we need to emphasize in pasture-raised flocks is we need to spend money on buying rams or selecting for rams that have history that they are resistant to parasites. So for me, I like data, so I like EBVs. I'm collecting it anyway, and it's been well worth the money. So that's for me what I would do. If I had a small flock and I had twin and triplet males, lambs to select from, I would be looking at the history of their mother relative to parasite control measures. Okay, but be sure to not be too critical of those ewes that are raising those big families or those families that wean a lot of pounds at weaning. And then make sure that you aren't just comparing like 3 animals to each other. All right. Now, if you're going to collect fecal egg counts, those lambs have to be out grazing, I would say more like 5 to 6 weeks so that they've had enough chance to take in worm eggs. I don't think lambs do a lot of grazing till they're a good month old or older. And ideally, those lambs have taken in enough worm eggs that if we did an average on the group, they were running 500 eggs per gram, and the higher the better. Because then when you look at your population of lambs, they're going to settle out on a bell curve. Okay, so when we're going to get the fecal egg count, the lambs have to have an ear tag. They have to have been grazing up until a few minutes before you started sampling them. Don't lock them up the night before. Been there, done that. That's a mistake. So you want plenty of poop. You want the group to be similar in age and all be raised together. In other words, if you lambed a group in February and you lamb a group in April, obviously that April group is going to have seen more grass than the February group. So just compare apples to apples. They have to be grazing for, like I say, about 5 to 6 weeks. They won't have any trouble unless you had really clean flock and clean pasture to hit that 500 eggs per gram. And we have to run quantitative fecal egg counts. So one of my frustrations years ago and continues today is the diagnostic lab in my own state doesn't routinely run quantitative fecal egg counts. We have to send them elsewhere. Okay, let's move on a little bit and we'll come back to that. There is a product that's been developed that's fascinating, and it destroys the larvae that have been passed out of the sheep on pasture, not in the sheep, but on pasture, but the sheep have to eat this product. So it's actually a fungus. It's marketed as bioworma. Here we can see this fungus wrapping itself around a worm. And it's got a lot harder name to say than bioworma. It's called Duddingtonia flagrans. And it's a naturally occurring fungus, and some really smart people figured out how to package it into containers that they could sell. And basically it destroys those larvae after they've been passed out of the sheep while they're on pasture. Dr. Weaver did some math on the dose, because the dose varies based on body weight, on what the cost per head per day. You'd have to pretty much feed it during the at-risk period. So for me, that would be June, July, and maybe a little bit into August. And I've been told that sheep don't like this. But I think we can convince sheep to eat about anything. One, if they're hungry enough, so got to feed it to them early, and probably have a fair bit of sheep candy mixed with it. That's what I call molasses. Okay, let's move on to pasture. We talked about not grazing any shorter than 4 inches. The rotation, I mentioned that certain times of the year, we're going to have that worm egg become infectious within 3 days. So pasture rotation alone won't control parasites, but moving every 2 to 3 days could be helpful. We wouldn't want to overstock and force those sheep to eat too far down. And there are tannin-containing forages. The most common one that I know of in this part of the country would be bird's foot trefoil, but there's also Sericea lespedeza that I don't know how well it grows here. And I don't know, I wonder if Kura clover would have any tannin. I guess I don't know, maybe Wayne could tell us that. Anyway, multi-species grazing, cattle can help reduce the burden out there in what was a sheep pasture, and more protein being fed to those lambs especially can help them combat parasitism. So I get calls, people tell me I've already lost 10 out of 100 and they want to dry lot them. And one of the first things I say is, be sure you feed plenty of protein while you're trying to nurse them back to health. Be sure you're getting them back to like at least a 16, if not 18% protein. And that will really help them combat their parasitism. I sort of mentioned targeted treatment of individual animals. The challenge I have in a small flock is FOMACHA scoring would have to be done every 2 weeks from the middle of June till at least the 1st of September. And we would treat everything that was a 4 and maybe 3s. But if we don't do it on every 2-week interval, then the homunculus can get ahead of the FOMACHA scoring, and we could end up with some heavily parasitized animals. So you can appreciate if you had 1,000 sheep that doing FOMACHA scoring every 2 weeks might not make everyone the best of friends. But if you have 30 sheep or you have 100 sheep and you either build or invest in a reasonable chute, it's certainly doable. Combination treatments, I went through that. I went through cow-up and a little bit on genetic selection. So this is just outside of my house. Yesterday, we had the rams grazing here. And yes, we took some of it shorter than 4 inches, but they are yearling rams. So we think they should have some age-acquired immunity. But this just shows you, kind of height. And then this is another slide that I think is fascinating. I'm trying to remember what colleague from, I think it was from Australia, shared this with me. But this shows you the importance of the rest period of the pasture as it affects or impacts the larval survival of the parasites. So if we look at our usual temperatures in the summer, running right here around between 70 and, well, yesterday we hit that, didn't we? And we look and find that purple line, so it's right here. And we look at, when do the parasites really drop off? When do they get below 50% survival? That looks like that's about, I can't draw a straight line, that's about 45 days. When do they get down here at 10% survival on that purple line? That's about almost 100 days. Now, most of us don't rest our pasture that long, but you can appreciate the longer you can rest it, the more parasite larvae will die. That's a great thing. I know some of you are shaking your head and say the longer we rest it, the worse the forage quality becomes because the feed gets overly mature. So you have to decide what's your trade-off. but I bet most of you had not seen this slide before, and I just think it's very helpful. Okay, who are the most susceptible to worms? Certainly the twins and triplets are more susceptible. I can think of a jillion reasons why. I don't think I really know. And here's what happens as the lambs get older. They do start becoming immune, some, but some do not, and some go on to die if we don't intervene. Okay, this is just showing a picture of, this is two different pastures, pretty hard to tell, except that there's not much mingling there, and how cows can be helpful. Here the cows are actually with the sheep at reducing the worm burden in the pasture. Now, sometimes we reach a point where we don't have enough pastures to either rest them or rotate often enough, and we start heading into a wreck. And that's when we really need to just pen those lambs up, feed them well, make sure they have the cleanest, most potable water in probably 2 locations, so they don't even have to really travel to get it, and clean those worms out of them with deworming. But it's going to cost us more to raise our lambs that way. So on your own farm, what's practical? What can you actually do? It's going to require a combination of different methods. Most of us have to relearn how to graze so that we don't graze too short. We don't graze continuously, and we learn to give combination anthelmintics, and we get kind of a really strong backbone, and we're willing to just treat the animals that need it, and we're willing to cull the animals that are struggling with parasites. We also need to consider the fact that those rams that we buy, even though they cost money, they make a huge difference in the outcome of your lambs. And so that may be a selection criteria, that you select rams that have a negative fecal egg count. What am I forgetting here? I think. The other thing Dr. Weaver really suggested, and as sheep producers in a general sense, not those of you on this webinar because you've already gone the extra mile, but use the data that we're collecting to make decisions. Don't use, oh, I really like the eye appeal of that animal. Use the data to make sure that you are making good decisions and that the lamb weights are improving every year. If that's true, then keep your plan. If it's not true, not happening that way, then you need to look at adding another tool to your control program. Okay, I think I better open it up for questions. I can't remember how we do that. Oh, thank you. So there's a colleague of mine in Australia, Dr. Sandra Baxendal, who I've never met, but I appreciate that, Sandra, that you have shared that worm survival graph is from a really good Australian website called wormboss.com.au for Australia. And I really appreciate that you, I'll save that information now so I can give credit where credit's due.
Dr. Wolf, a couple questions here, and I'll kind of help to provide a little bit of continuity to them. One question comes of, if you irrigate your pastures, is there any particular chemicals that can kill the eggs/worms?
Well, I guess you feel like people listened when they ask a question that you absolutely can't answer. Is there anybody else who can answer that? I'm not very well versed on irrigation, and I'm not aware of anything that is effective that is also animal compatible, but I will have to do some asking on that one.
That's okay. We'll find a more fun one. All right. And so the question comes in relation to kind of the administration of the copper, most likely from the boluses. And we had a little bit of information there of kind of saying, is there a question in terms of whether they need to have an empty stomach, or is that copper bolus can be administered at any point in time? And do you have any guidance in terms of when that can be, given?
So those, as far as I'm aware, the copper oxide wire boluses will work just fine regardless. But I will say that your other chemical dewormers, so your valbazen and your cydectin and your Levosol, they will work better on an empty stomach. That is a proven point and a really good point. The challenge for me is trying to figure out how to make that effective. In other words, when I gather a group of lambs, like I say, if I take them off pasture and I want to get poop for fecal egg count samples, and I want to FOMACHA score them, and I'm going to use that FOMACHA score to decide who to deworm, I need to be sure I have a reasonable amount of poop in that rectum. And so if I hold them off feed very long, like half a day, I may not have a good amount to sample. And how much do we need for a fecal egg count? We need a tablespoon. Some labs will get by with less, but a tablespoon is a really good rule of thumb. And so you take a 45-pound lamb and you put your 2 gloved fingers, that all you have to do is dip it in a water bucket, okay? And you go in there and you milk that out into a baggie, and someone else is just labeling them with a Sharpie. Just be sure you get all those baggies sealed, because you're gonna pack it in a cooler with a cold pack, and fecal soup is a real thing.
So this wasn't particularly one of the questions, but at least a question that I get, because I think that there's people that, want to do fecal egg count at home, or at least provide what the correct approach is of if they were to provide that to their veterinarian. And so what is your suggestions there? And I know that even some of the people that I've worked with, can purchase, as strange as this sounds, a junior high microscope off of eBay or something, and get the McMaster slides. But what is the entry level in terms of trying to do some fecal egg count work on their own, or to work with their veterinarian, Dr. Wolf?
So this comes down to money sometimes. Go to that wormx.info website, and there are some great training videos and fact sheets on being able to do your own fecal egg counting. And it's difficult for a veterinary practice to charge you less than $15 to $30 per sample, because their technician is running it and she's making X per hour and so forth. So you follow what I'm saying? So that's why that wormx.info consortium came up with a list of labs that run them at reasonable rates. And that's why I kind of also mentioned that lab in Michigan. Like I say, I haven't used it yet, but they're very cost effective. And I intend to try them out. So I think that all producers could learn how to do their own. I will just tell you that it's like anything, like when you sit down to pay your bills or do your taxes, you need to have a designated time every 2 weeks that you're going to run those egg counts, because it's tedious work that no one loves. And so you have to be disciplined, which is why it works better for me to just get the samples and send them out and be grateful when they come back in Excel format that I can then import where I want to put it. I don't know, Travis, did I just answer that question?
Yeah, that was perfect. I know that, and again, I appreciate that on the fecal egg count. A lot of times, as you're aware, people want to do the, at least evaluation from, kind of the FOMACHA scoring. I mean, do you recommend that they can kind of pull that from a spot that's on the internet and available to them? And I know that there's, we now have, at least within our sheep industry, some trainings that can be done so that people are more talented in terms of the FOMACHA scoring. But do you just suggest that they kind of pull that bottom portion of the eyelid? And what is your thoughts in terms of just your quick presentation of saying, this is what you can do as you're running sheep together or sheep or goats, of course, in terms of the FOMACHA approach?
So a couple things about the FOMACHA score card and the training is that you should get some training. But to me, the main things are being able to look at the first day, look at 20 animals and start to stick your neck out there that I really think this is a 1, 2, 3, 4. We can all spot a 5, and I think we can all spot a 1. And then you'll quickly so they got to be either confined tightly in a pen or confined in a chute. You take your thumb and you pull the upper eyelid over the eyeball, push a little bit against the eyeball, you're not hurting the animal. And you take your other hand and you roll out the lower eyelid and you're looking at the color. Now, you'll be, my husband will say, where's your third hand? How do you hold that card up there? And so you'll see people have learned how to either tape the card to their hand that they're pulling the lower lid down. Or one time my colleague and I did a session and we went to the store, and the first time ever bought nail polish, and we just painted our fingernails the corresponding FAMACHA colors. And that actually works really well, to tell you the truth. Anyway, you get pretty good at telling what a 2, a 3, and a 4 is. And even if you're not exact, the perfect FAMACHA scoring is done every 2 weeks. It's done outside because the inside light will change it. I should tell you, if I were training you, you had to do both eyes, but I'm a practical person, and you don't, people will not do both eyes. So we just do one eye, and we don't leave that lower eyelid rolled out and blanch the color out of it. So you look at it immediately as soon as you roll it out, and then you call your score. So that's the method. But again, thank goodness with YouTube and that wormx.info site, there's just great information, and you could train yourself. But if you ever get a chance to come help somebody when they're going to FAMACHA score, and you know they have parasites on their farm, that would be a great way to get, you know, the experience you need. Now, the FAMACHA card's supposed to be kept in an envelope when it's not in use. And because they fade, you're supposed to replace them every year. I would say replace them at least every 2 years. But so I think I covered all that.
Absolutely.
And I feel anybody can learn it. Yeah.
Thank you, Dr. Wolf. That shows a tremendous amount of dedication to your craft, to use fingernail paints of 1, 2, 3, 4, and 5. And so I've yet to hear that, and so I appreciate that as an option for us. Okay, and so a couple of questions as we kind of dig through these, and you may have seen these on the chat, and I think this one's a tricky one as well. Of how do you rotate? And you said, you know, if you run out of pastures, that maybe you need to come in and dry lot them, or make that decision in comparison of whether they need to be on grass or, you know, in between, potentially, in terms of the dry lot. But one of the producers, and I think this is common to several people, if they have 5 or 10 pastures, and truthfully, or excuse me, 5 to 10 acres, and then, you know, pasture rotation becomes more of a challenge. What is your thoughts? I mean, again, you said, well, you can pull them in for a little bit and let that larva kind of move through its stage, but I welcome your input.
So that is a challenge, because it's easy with sheep and goats to grow our numbers beyond what we have. Or like last year, a lot of our state got affected with the drought. So be a little creative. If your sheep are pretty well trained to electric fence, see if your neighbor has any unused grass so that you can give yours a break. And if you have to, then consider pulling them in and just dry lotting them for 2 weeks to give your pasture that you were on the longest to go a chance to grow back. Over time, if you don't give your pasture enough rest, parasitism aside, you're going to regret that, because your forage quality is going to really suffer. Kind of think about it like if I guess I can't think of a good example, but remember those nutrients in the soil and those root reserves in the forage, that they all need to be fed, but they need a rest to grow. And so that rest period just becomes incredibly important.
Okay, so 2 questions here. One of them is the moxidectin, is that available as a gel, and is that effective? Is what was written. And then the second follow-up of that is that, are there any organic options for deworming?
Let me answer the last question first. My understanding is that copper oxide wire particles are acceptable as far as organic standards. As you could see in that data, they didn't do the best job alone. Then you would be asking, well, does garlic do anything? And I guess if anybody finds a paper where garlic has been evaluated in a really sound study, I would love to have that shared with me, because sometimes we give garlic credit where it was really management that should have got the credit. So I think management is critical, and genetic selection is critical when we raise animals organically. And I used to tell the audience, don't name your sheep. So if you're starting out and you've got 30 sheep and it's all organic operation, then the name on that one that needs to be culled because it has struggles with parasite is bye-bye. So it's okay to name them, but you got to act on the names sometimes. The other question on the moxidectin gel, I think that's a horse product. And the way our parasitologist would answer you is that you should use a product that has been developed to be used in that specific species. So I imagine the person asking that question is asking that because we can't get really small quantities of cydectin, but and so you could get, a small quantity of moxidectin gel, but you will do much better using this cydectin made for sheep. So find a sheep friend or a goat friend who has some and go buy the amount you need out of their bottle is my best suggestion.
I'm going to draw the question back a little bit to breeds of sheep / goats, Dr. Wolf. And so, you brought up of some, obviously, breeds are more resilient to parasitism in generalities. Do we know kind of if and why? And I know that that's a tricky question because I don't know that. And that's why I guess I'm posing that one to you. And I guess my follow-up on that would be that, even if there is differences within the breed, I think that we can always be in consideration that there's even more differences amongst those same breeds of your same operation. And so you can be able to evaluate that. And so I just was interested in, I guess, your big picture thoughts in terms of breed versus selection within those breeds of an operation.
Travis, I feel like the more we look at this, the more we realize we do have animals within the breed that can help us. And I really appreciate that there are some breeds that, I think when the group in West Virginia started looking at the Texel, I think they had an inkling based on data from overseas, but I think they were kind of really pleasantly surprised at how much resistance they found. But on the other hand, we all have our favorite breeds. And when you look at people's fecal egg counts that they run for the first time, where they haven't done a lot of selection, maybe nature's selected, like nature's killed some lambs from parasitism, but the people haven't done a lot of selection. It just blows me away because there's a bell curve right there. And do we do what we probably should have done? I know I didn't the first year I had those fecal egg counts back. I know I should have looked at getting rid of, if it carried through to their EBV, I should have just got rid of, all those positive animals. I got rid of a lot of them, but there were some I made excuses for. While they didn't have names, I'd be like, but look at her conformation, or look at how many pounds of lamb she weaned. I had an excuse. And so I think within a breed, we can find that we all have the best animals there, and then we all have some that should go elsewhere.
Okay, I'm going to backtrack just a little bit because I really appreciated your talk in terms of the antibiotic use and what's going to change in terms of the over-the-counter medications. Is there any specific record keeping requirements that you expect producers to keep, and whether that's a current over-the-counter or prescription medications that they have? what do you say? So let's just say I'm a goat producer in central Minnesota, and do you say, okay, this is what inventory I have? Provide expiration dates. How do you say that people can manage what pharmaceuticals are currently on hand in their operation?
So you're asking like two questions. I'm going to focus on where I think the critical part is that we didn't say out loud. We need to all do better keeping our individual animal treatment records. So we have a simple notebook, loose leaf binder, and it just has the date, the animal ID, the drug that was given, the dose that was given, the dates it was given, and then it should have a column that says when it's clear of its residue, but it doesn't, right? But it should. And you'll be frustrated because you'll be like, well, I don't know what it is for Draxxin because it's not approved for sheep, but it is approved for goats, right? And so just want to share with you that there is this tool called FARAD, the Food Animal Residue Avoidance Database, and there is some publicly available information on it. And what isn't there that you want to know, your veterinarian can write an email, and if it's not written on a Friday, then within 24 hours they should have that information back on what the withdrawal time is. Okay, so, and they should share that with you, so that you have that. But the other thing you're asking me is about a drug inventory, and I think that as producers we could do better if we listed. We had a bottle of Bosi, and this was the expiration date. We had a bottle of high potency B complex, and this was the expiration date. We had Oxytet 200 milligram per mil, and this was the expiration date. And the reason I bring all that up is because maybe your farms are not like mine, but where I am, sometimes I'll get a case where I wanted that B complex, and I look and my bottle's out of date. And I'm like, darn, this isn't very good timing. So if I had it all, on an Excel spreadsheet, then I could look at it a lot more easily than I would ever look at the bottles, right? And the same would be true going into lambing. You'd be sure you had everything you wanted in date. People always ask me, is this still going to work? I don't love that question. That's like, again, the crystal ball, which way is it that day? I can only tell you a story about a little lamb that we had with polio, and it wasn't getting better. It wasn't getting better, but twice a day, it still got its B complex. And finally, one of my daughters, they were little then, said, Mom, this bottle is expired 2 years ago. Why we still had it, I don't know, but we did. And they said, would it get better if you gave it some in date? And I said, I don't know, but I went on the computer and I ordered it, and we had it the next day, and lo and behold, the lamb got better within 24 hours. So that's my story on expiration dates, but we should keep an inventory. We should keep those products at a stable temperature that they're supposed to be at, and we should try to turn over our inventory so that if a bottle ever looked like it was contaminated or it's out of date, we kindly said goodbye and replaced it.
Thank you, Dr. Wolf. I appreciate, again, pulling in that information in terms of judicious antibiotic use, and particularly as it continues to change, and the importance that we have in terms of our valid veterinarian-client-patient relationship. And as I said, I know particularly as we're at the front end of summer, or at least pushing into it with green grasses, which is great. And again, I get to share with Minnesota and North Dakota. And so I'm excited that North Dakota has green grass as well. So that's a bonus that we haven't had in previous years, but also Minnesota, of course, gets that. And the challenge is we look and we pass out those sheep and goats to the grasses that we get excited that it is green. But what we do know is that the larvae and our parasites, Dr. Wolf, also enjoy green grass, right? And so that's the challenge that we get to play in comparison to a foraging ruminant species. And so that's a fun one that we get to manage. And I think that you have continued to provide us great information, from genetic selection to management on what we can do for parasite resilience and resistance and what happens for those. And so I'm going to give you the floor one last time, Dr. Cindy Wolf, in terms of particularly what we can accomplish and just your parting thoughts here as we think about it in terms of judicious antibiotic use and parasite management for sheep and goats. And I'd like to thank our participants for joining us and my talented team at the University of Minnesota Extension on our sheep and goat team. Cindy, what are your parting thoughts for talented people as we move through the summer of 2022?
I guess I have one message, and that's that if you haven't caught a couple lambs and looked at their FAMACHA score, and also even if you don't think you have a parasite problem, maybe do me a favor, find one of those labs that you think is affordable and grab, 3 to 5 lambs worth of samples and send it off just so you're ready for July, because parasite season is very happy to be here.
Thank you, Dr. Wolf, for sharing your insight, knowledge, and expertise for our program. And with that, we'd like to thank all of our participants for joining us, and we look forward to you visiting us again at our next functions that we have with our University of Minnesota Extension Sheep and Goat team, and providing webinars for you that are timely, pertinent, and help us to drive to discover. Thanks again, and have a lovely night.